Welcome to a training on speech-language pathology assistance sponsored by the New Mexico Speech and Hearing Association. I'm Sandra Nettleton, President-elect of the New Mexico Speech and Hearing Association and Clinic Director at the University of New Mexico Department of Speech and Hearing Sciences. In terms of disclosures, I have no relevant financial or non-financial relationships to disclose. This PowerPoint presentation is available on the NMSHA website by clicking on the link below. CEUs are also available by clicking on the link below the video and follow the instructions. Most of the references used for this presentation are published through ASHA, specifically the SLP Assistant Scope of Practice and Ethical Documents, and the references are listed here. While ASHA endorses the use of trained and supervised personnel and has guidelines, these ASHA guidelines do not supersede federal legislation or state licensure laws, nor does it affect interpretation of those laws. Throughout this presentation, I will be referring to two surveys that were completed with SLP assistants and SLPs in California that gleaned some interesting data of relevance. Both surveys are published by Jennifer Ostergren and Sarah Aguillard from the California State University at Long Beach. Who are speech-language pathology assistants? ASHA designates speech-language pathology assistants as support personnel who, following academic coursework, fieldwork, and on-the-job training, perform tasks that are prescribed, directed, and supervised by ASHA-certified speech-language pathologists. States will differ in terms of terminology to refer to assistants in speech-language pathology. Some states will call them aides, others assistants, and others paraprofessionals. As many of you know, the Regulation and Licensing Division in the state of New Mexico has licensed speech-language pathology apprentices for a number of years. It's important to understand the distinct differences between apprentices and assistants in our state. First, apprentices are currently licensed in New Mexico. Speech-language pathology assistants are not. Apprentices is a temporary license with supervision from a licensed speech-language pathologist. Apprentices must have a bachelor's degree in speech-language pathology or 30 hours of course credit in communication disorders. They must be enrolled in a master's program in communication disorders, or they will enter a program within 2 years of initial licensure, and then it also gives specifications regarding a grade point average. Speech-language pathology assistants, on the other hand, are not currently licensed in New Mexico. Although our current state licensing board is proposing an SLP licensure to the New Mexico legislature within the next year. SLP assistants are currently hired as licensed school-based paraprofessionals within our state through the Public Education Department. A main difference between apprentices and assistants is a permanent license with supervision by a supervised SLP, as opposed to apprentices, which is a temporary license. Many assistants have a bachelor's degree in communication disorders, plus 100 hours of clinical experience, or an SLP associate degree, so either the BA or the associate degree in this case. Use of SLPAs. According to the ASHA Executive Summary, some tasks, procedures, or activities used to treat individuals with communication and related disorders can be performed successfully by individuals other than a licensed speech-language pathologist if that individual is properly trained and supervised by that speech-language pathologist. The utilization of evidence and ethical and professional judgment should be at the heart of the selection, management, training, supervision, and use of support personnel. This is particularly true given that ASHA and many state board of ethics do not regulate complaints against speech-language pathology assistants. It's the SLP supervisor who is responsible for assuring ethical conduct on the part of the assistant. SLP assistants can practice in a number of settings. Under the specified guidance and supervision of an SLP, SLP assistants may provide services in a wide variety of settings, including public, private, and charter elementary and secondary schools, early intervention settings, hospitals, residential healthcare settings, non-residential healthcare settings, private practice agencies, and university and college clinics. NMSHA performed an informal survey within the state of New Mexico as to where speech-language pathology assistants were found, and was able to identify a handful of employed assistants in rural school districts and a few in medical settings. The important thing to note here is that speech-language pathology assistants are not just found in school settings, and so only having a licensure through the public education department is not sufficient. Agencies and supervisors must assure compliance with the following. First, they need to assure that the SLPA identify themselves as an assistant. They should have a name badge with qualifications. They should have written qualifications that are provided to other professionals, clients, and families. The qualifications should be verbally expressed as introduced to professionals, clients, and families. We also must assure that the SLP assistants comply with HIPAA and FERPA regulations, reimbursement requirements, and responsibilities of the speech-language pathology assistant. What sort of tasks are within the scope of practice for a speech-language pathology assistant? Provided that the training, supervision, and planning are appropriate, tasks in the following areas of focus may be delegated to the assistant. They can assist the speech-language pathologist during assessment of students, patients, and clients, exclusive of administration or interpretation. They may follow documented treatment plans and protocols that are developed by the speech-language pathologist. They can document student, patient, and client performance, such as tallying data and data collection, and report this information to the SLP. And they may program and provide instruction in the use of augmentative and alternative communication devices. SLPs who have the skills in a second language may serve as interpreters when needed. It has been recognized that often additional training is needed as an interpreter. ASHA provides the following resources for working as and with an interpreter, as listed here. What other tasks are within the assistant's scope of practice? They can provide administrative support. They can assist with preparation of materials and scheduling activities as directed by the speech-language pathologist. They may perform checks and maintenance of equipment, and they can assist with departmental operations, such as record keeping, safety and maintenance of supplies and equipment. Assistants can also help with prevention and advocacy. They can present primary prevention information to individuals and groups known to be at risk for communication disorders. They can advocate for these individuals and families through community awareness and education. And they may also participate at the local, state, and national levels for improved public policies, and most definitely participate in activities and professional organizations such as NMSHA. You may note that within the scope of practice for speech-language pathology assistants, it mirrors that of apprentices within our state. According to the Ostergren and Aguiar survey of 64 SLP assistants, the majority of them served to follow documented treatment plans, to document client performance, and to assist with clerical duties. That was their primary roles. What is outside the scope of practice for a speech-language pathology assistant? The assistant should not engage in any of the following. He or she should not represent him or herself as a speech-language pathologist. They should not perform standardized or non-standardized diagnostic tests, formal or informal evaluations, or swallowing screenings. They should not perform procedures that require a high level of clinical and technical skills, such as vocal tract imaging and oropharyngeal swallowing treatment. Nor should they be providing interpretive information to the student, patient, or client, or family, or others regarding the patient-client status or service. All of that needs to be accomplished by the certified speech-language pathologist. The SLP should not engage in the following. They should not participate in formal parent conferences, case conferences, or any interdisciplinary team without the presence of their supervising speech-language pathologist. They should not write, develop, or modify a student's, patient's, or client's treatment plan in any way without that adequate supervision. They should not sign any formal documents such as treatment plans, reimbursement forms, or reports. They can sign or initial informal treatment notes and co-sign with the speech-language pathologist. Assistants should not engage in the following. Assist students, patients, or clients without following the individualized treatment plan prepared by the certified SLP and or without access to supervision. They should not be selecting patients or students for service, discharging patients or students for service, making referrals for additional service, or developing or determining swallowing strategies or precautions for clients and families. Finally, the SLPA should not engage in any of the following. They should not disclose clinical or confidential information, either orally or in writing, to anyone other than the supervising pathologist. They should not treat medically fragile or complex clients independently, nor should they design or select AAC communication systems or devices. And it's important to note here that state laws may vary according to the specific scope of practice and out of scope of practice guidelines for that particular state. So speech-language pathologists and assistants need to refer to the state licensing laws regarding this as well. You may ask, what are the advantages of an SLP assistant? Results of surveys and report indicate that the SLP may increase the frequency and intensity of services to patients or clients on his caseload if he or she has assistance by an SLPA. The SLP may focus on more professional level tasks and achieve more efficient use of their time and resources. According to the ASHA 2000 Schools Survey, 47% of respondents reported that the use of SLPAs led to more time for service. 23% of them said that the use of assistants led to more planning time and consultation with teachers, all good things. The ASHA 2009 membership survey indicated that 36% of speech-language pathologists had more time to work with complex clients, 33% reported less clerical duties, and 29% indicated a higher caseload or workload with SLPAs. Results of the Ostergren and Aguillard survey indicated that 73% of the SLP surveyed reported the overall impact of assistance as positive or strongly positive. Those are important percentages, 73%. Major advantages reported of assistance is that it included better caseload management for the SLP. They had more time to focus on program development and objectives. They had more time to collaborate with families and professionals. They had more time to attend meetings. They appreciated the assistance with preparation of materials and clerical duties as well. ASHA guidelines and most states recommend that the speech-language pathologist supervise no more than 2 assistants at any one time, given the scope of work and the amount of supervision required. So the question is, will SLPAs be used to replace speech-language pathologists? The simple answer is no. SLPAs support clinical services provided by SLPs. They do not carry their own caseloads. ASHA and most states do limit the number of assistants an SLP can supervise, as well as their scope of practice. And as I said, most states use the ASHA guidelines and recommend that the supervisor has no more than 2 SLP assistants at any one time. There are many tasks that only a licensed SLP can perform, and this will limit the number of assistants. What are the reimbursement guidelines, the current guidelines for SLP assistant services? In terms of Medicare, services of assistance are not recognized by Medicare. Services provided by assistants will be considered unskilled services that are not reimbursable through insurance, and they're not defined as reasonable and necessary if they are billed as therapy services within Medicare. In terms of private insurance as well, private insurance may not cover the services of assistants in many states. New Mexico is one of those that does not reimburse private insurance for assistant services. Medicaid reimbursement of SLPAs will vary from state to state. So it's important that you contact the National Association of Medical Directors to determine the coverage in each state. And New Mexico also is one of those that does not reimburse speech-language pathology assistants for their services. One of the important related questions is whether agencies credential assistants in their state. Currently, ASHA does not credential SLPAs, and given that they are not licensed, this is not happening in New Mexico. They are, however, licensed as paraprofessionals by the State Public Education Department. What are the educational and training requirements for speech-language pathology assistants? The educational requirements in preparation for assistants may vary considerably from state to state and by practice setting. ASHA currently does not accredit or approve SLP education or training programs as they do master's degree programs or PhD level programs. There are currently 27 programs reported utilizing SLP training, including Arizona State University, Northern Arizona University, the University of Colorado, the University of Northern Colorado, and the University of Houston. So you see we have training programs in all of our surrounding states of Arizona, Colorado, and Texas. Currently, there are no speech-language pathology assistant training programs in the state of New Mexico. At this point, NMSHA has not identified any New Mexico university that is able and willing to support an SLP training program, assistant training program, due to the focus on other initiatives, but this is subject to change at any time. ASHA suggests minimal qualifications for training for speech-language pathology assistants. First, there are degree requirements. ASHA suggests an associate's degree in a speech-language pathology associate program or a bachelor's degree in a speech-language pathology or communication disorders program, one of those 2 degrees. In addition to the degree requirement, ASHA suggests clinical experience or successful completion of a minimum of 100 hours of supervised field experience or its clinical experience equivalent. In addition to the degree and the clinical experience, there's often an observation experience that is recommended, including direct on-site or video observation of an ASHA-certified SLP as part of the training requirements. Let's talk a bit about coursework for SLP assistants that are recommended. In terms of general education courses, ASHA recommends oral and written communication courses, including grammar and usage, composition and business writing. They recommend general education in mathematics, technology, social and natural sciences. Then there are suggested technical courses, such as overview of normal processes of communication, including normal speech, language, and hearing development, overview of communication disorders, including introduction survey to communication disorders in both speech and language, review of anatomy and physiology of the speech and hearing mechanism, and instruction in assistant-level service delivery practices. Obviously, there needs to be instruction in the workplace and behaviors related to the workplace. Assistants must learn to relate verbally and non-verbally to client caregivers in a professional manner. They need to be able to accept and implement supervisor feedback, maintain confidentiality and security of client information, follow health and safety precautions, and they need to be able to communicate effectively, as we know, in oral and written formats that are consistent with federal and state regulations. Finally, certainly in the state of New Mexico, assistants must be adept at understanding the cultural and linguistic factors of communication. So aspects such as language and culture, interpersonal communication, sign language, bilingualism, and other multicultural issues. Additional curriculum and experiences should include, obviously, the training and strategies and techniques that they will be using with their clients in terms of treatment plans and data collection. They need training with specific populations that relate to their particular settings. So this might include autism, cerebral palsy training, other populations. A big one is training and documentation, such as SOAP notes, data collection, and then of course, once they are employed, they need training specific to their particular practice setting. According to the Ostergren and Aguillard survey, a majority of the assistants felt that critical elements of their training included treatment strategies, population disorder knowledge, and data collection, which is consistent with these observations. ASHA has established an associate affiliation program for support personnel initiated to improve the use of support personnel in speech-language pathology and audiology. I don't know if you're familiar with the ASHA associate program. In order for a support personnel to be eligible as an associate, they must meet the state licensing, certification, and registration requirements as an assistant. They must agree to adhere to the ASHA policies for support personnel. There is an annual fee. And if they're currently employed as a speech-language pathologist assistant, the supervising SLP must attest to their competence as an assistant or the program director at a university. If the support personnel is indeed an ASHA associate, they do get benefits. One of the benefits is they can obtain professional development hours. They have networking opportunities with other associates. They have access to online career center. They have benefits such as insurance, credit card offers, and car rental, and most importantly, they can obtain liability insurance as a group rate. So their benefits are very similar to professionals in speech-language pathology and audiologists. What are the SLP assistant supervisor qualifications? ASHA provides some guidelines on this. Obviously, they recommend ASHA certification and/or state licensure is a must. ASHA recommends that speech pathology supervisors complete at least 2 years of practice following their clinical fellowship years, or 3 years total as a supervisor or experienced SLP. ASHA also recommends that the supervisor complete an academic course or at least 10 hours of continuing education in the area of supervision. This may be a bit tricky for most speech-language pathologist supervisors to obtain. However, ASHA does have resources for training and supervision as well as university and colleges. Our university here at UNM provides resources and training for supervisors. What is the recommended amount of supervision for speech-language pathology assistants? ASHA delineates this according to the first 90 days of employment and the second 90 days of employment. In terms of the recommended amount of supervision for the first 90 days, ASHA recommends a total of at least 30% supervision weekly, including at least 20% of direct and 10% of indirect supervision. It's also important that the supervisor assures data on every student and that they assure that they are supervising every patient and client seen by the associate or the assistant. They should vary the supervision days and time of the day so it can be altered to ensure that all students, patients, and clients receive some direct contact with the speech-language pathologist at least once every 2 weeks. So what is the recommended amount of supervision after the first 90 days? Well, the SLP supervisor is given some discretion in this case. The amount of supervision can be adjusted if the supervising SLP determines that the assistant has met the appropriate skill levels for their variety of communication and related disorders. The minimum ongoing supervision must include documentation of direct supervision provided by the pathologist to each student, patient, or client at least every 60 calendar days. The supervising SLP must provide at least 1 hour of direct supervision weekly and as much indirect supervision needed to assure maintenance of quality services. ASHA also recommends 100% supervision of medically fragile clients. In order to maximize supervision and effectiveness of assistance, ASHA suggests no more than 2 full-time equivalent SLPAs in any one setting. Additionally, we want to ensure good, not just minimal contact with clients. So you want to alter the supervision days and time of days so that clients receive some direct contact time with the SLP at least once every 2 weeks. According to the Ostegren and Aguillard survey of speech-language pathologists, a majority of them supervise their assistants between 3 and 10 hours per week, depending on the level of training and experience of the SLPA. The survey of SLPs indicated that the level of supervision depended primarily on the previous experience and training of the assistant. The needs of the client was also a factor, with more severe clients requiring more supervision. In terms of caseload and workload management with speech-language pathology assistants, it's important that the SLP takes time to adequately supervise their assistant and that agencies consider caseload and workload formulas. ASHA provides resources for workload analysis through their website. Most of you who work in the schools are familiar with the workload analysis approach. And once again, SLPAs are not to carry their own caseloads. Rather, they are helped to provide services to the caseload as directed by the speech-language pathologist. The Code of Ethics comes into an important play when it comes to speech-language pathology assistants. And specifically, the ASHA Code of Ethics states that it is imperative that pathologists and assistants behave in a manner that is consistent with the ASHA Code of Ethics. Most important, the amount and type of supervision should meet the minimal requirements and be increased based on the experience and need of the assistant, student and clients, their service setting, and task assigned, and other factors. So the amount and type of supervision must be considered in order to follow that Code of Ethics. The SLP must ensure that roles and responsibilities are clearly delineated so that the assistant knows what's within their scope of practice and outside of their scope of practice. SLPAs must be appropriately identified to consumers, employers, colleagues, and regulatory and funding agencies. These are all important behaviors when it comes to the Code of Ethics. Now, I have listed here principles and rules that most apply to assistants. These are on the ASHA website. Most specifically, the principle of Ethics 1, that individuals shall honor their responsibility to hold paramount the welfare of persons that they serve, that individuals shall not misrepresent the credentials of themselves, that SLPs shall not delegate tasks that require the unique skills and knowledge of a professional, and that SLPs may delegate tasks related to the provision of clinical services to assistants only if those assistants are appropriately supervised. Here are some additional code of ethics that relate to SLPs and assistants for you to read. In addition to the resources that were stated at the beginning of this presentation, here are some other resources that are available to supervisors of assistants. I would like to point out the ASHA electronic workshop. Effectively using SLP assistants to support quality service delivery is a very good resource for supervisors. In addition to that, the article by Vicki McReady on supervision of SLPAs, a reciprocal relationship, provides some very good tips as well when it comes to the supervision of SLPAs. In conclusion, as ASHA and states move forward with the provision of assistance throughout our nation, more resources, training, and regulation is needed. I'm hoping that this presentation has given you some preliminary information and guidance when it comes to supervising SLP assistants within your setting, or if you're considering to have assistants within your setting. Thank you for your attention and best wishes.